States, even for vaccinated people. Now, in areas where there are high or substantial COVID transmission, that actually covers more than 66% of the country. Why? Well, the highly contagious Delta variant has ignited a summer surge in new cases after months of decline due to widespread vaccination. You are looking now at the president inside the East Room as he is about to make these remarks. They are not calling it a mandate, but the president trying to impose strict new guidelines to get more people vaccinated, especially those who work for the government.
Today I want to talk to you about COVID-19. Maybe the best way to start is, in a significant part of the country, you wouldn't have to take one of these off. You don't have to put one on. Like in my home state of Delaware, where I live in Newcastle County, where I was yesterday in Pennsylvania, because people got vaccinated. They got vaccinated. They don't need a mask when the vast majority of people got vaccinated. Look, I want to talk about what's really happening, what it means, what it doesn't mean, and what we need to do this week and the months ahead. For the moment I was elected, I said I'd always give it to you straight from the shoulder. And we need some straight talk right now, because there's a lot of fear and misinformation in the country. And we need to cut through it with facts, with science, with the truth. So, what's really happening today? After months and months of cases going down, we're seeing a spike in COVID cases. They're going up. Why? Because of this new form, this new variant called the Delta variant. This is a much different variant than the one we dealt with previously. It's highly transmissible, and it's causing a new wave of cases in those who are not vaccinated. Our experts tell me that cases will go up further before they start to come back down. But while cases are on the rise, we're not likely to see, according to experts, a comparable rise in hospitalizations or deaths in most areas of the country. So you have to ask yourself, why is that? Because 164 million Americans are fully vaccinated, including 80% of the most vulnerable, our seniors. So there's a challenge, as you knew there could be. But there's also good news. We've spent the last 6 months preparing for this possibility. The vaccines are highly effective. We have enough vaccine for everyone to get vaccinated. And thanks to the American Rescue Plan and the hard work of the American people, we've administered over 325 million vaccinations doses in the past 6 months. We have the tools to prevent this new wave of COVID from shutting down our businesses, our schools, our society, as we saw happen last year. I've said from the beginning that we will be guided by the science. So here's what the science tells us. On Tuesday, the Center for Disease Control and Prevention, the CDC, announced its new mask recommendation in parts of the country where COVID cases are substantially high, where people didn't get vaccinated, which they define as 50 new cases for every 100,000 people in a week. The CDC recommends you wear a mask when you're in public and indoors, like work or in a grocery store. That's true for both the vaccinated and the unvaccinated. Why? Because even if you've been fully vaccinated and protected from severe illness from COVID-19, you could have the Delta variant in your system and spread it to someone who isn't vaccinated. We need to wear a mask to protect each other and to stop the rapid spread of this virus as we work to get more people vaccinated. And I hope all Americans who live in areas with substantial or high case rates will follow the mask guidance that's being laid down by the CDC. I certainly will, and I have, because this is one of those areas in Washington. And at my decision, in my direction, all federal personnel and visitors to federal buildings will have to do the same thing. As I said from the beginning, a mask is not a political statement. It's about protecting yourself and protecting others. Masking is one defense against the spread of COVID-19. But make no mistake, vaccines are the best defense against you getting severely ill from COVID-19. The very best defense. And you want to know how we put this virus behind us? Well, I'll tell you how. We need to get more people vaccinated. Look, and it's important to understand what vaccines do and what they don't do. Put simply, the vaccines are designed to save lives and prevent severe illness. They're highly effective at both. 190 million Americans have had at least one shot. Of that group, about 90% are done now, and 10% are waiting for the second shot. To those folks who have one shot, but not the second, go get the second shot. Even if you're overdue for the second shot, it's not too late. Go get the second shot now. The bottom line is if you're fully vaccinated, you're highly protected from COVID-19. But I also know that many of you who are vaccinated are concerned about what's called breakthrough cases. Yes, some fully vaccinated people will still test positive, and some will show some symptoms of COVID-19. That's expected with almost every vaccine there is for other diseases. But breakthrough cases remain rare, and almost all are mild cases. In fact, virtually all hospitalizations and deaths are among the unvaccinated. I also know many of you are wondering if you need a booster shot to add another layer of protection. As of now, my medical advisors say the answer is no. No American needs a booster now. But if the science tells us there's a need for boosters, then that's something we'll do. And we have purchased the supply, all the supply we need to be ready if that was called for. Folks, the truth is, as more people get vaccinated, we are better protected as a nation to continue reopening safely and responsibly. We are not fully out of the woods yet, because what is happening in America right now is a pandemic of the unvaccinated. Let me say that again. It's a pandemic of the unvaccinated. There are about 90 million Americans who are eligible to get the shot, but haven't gotten it yet. As I just mentioned, nearly all of the cases, hospitalizations, and deaths due to COVID-19 today are from unvaccinated people. Last month, a study showed that over 99% of COVID-19 deaths have been among the unvaccinated. 99%. This is an American tragedy. People are dying and will die who don't have to die. If you're out there unvaccinated, you don't have to die. Read the news. You'll see stories about unvaccinated patients in hospitals. As they're lying in bed, dying from COVID-19, they're asking, "Doc, can I get the vaccine?" And the doctors have to say, "Sorry, it's too late." Right now, too many people are dying, or watching someone they love dying and saying, "If I just got vaccinated, if I just." It's heartbreaking. And it's complicated even more because it's preventable. America's divided between the majority of eligible people who are vaccinated and those who are not. And I understand that many of you in the majority are frustrated with the consequences of the failure of the minority to get vaccinated. But I want you to know that I'm going to continue to do everything I can to encourage the unvaccinated to get vaccinated. That includes addressing hesitancy and misinformation head on. For example, I know some of you who are unvaccinated think the development of a vaccine was rushed, therefore I'm not going to take a chance. As a result, I think it's not safe because it was rushed. I understand. But let me explain. Our top scientists, the National Institute of Health, the NIH, and across the country, got to work applying decades of research. Decades of research. I'm going to repeat that. Decades that had already been done, the research, to develop the COVID-19 vaccine when it hit. In the last 6 months, more than 325 million doses of the vaccine have been administered in the United States and billions of doses administered around the world. The vaccine was developed and authorized under a Republican administration, and it's been distributed and administered under a Democratic administration. The vaccines are safe, highly effective. There's nothing political about them. Look at all the people who took a shot at it. We learned a lot of them had already been vaccinated. From the start, I have to compliment Republican Senate Minority Leader Mitch McConnell. He hadn't made it political. He's encouraged people to get vaccinated and continuing to do so, and his state's in pretty good shape. Alabama Republican Governor Kay Ivey recently spoke out to encourage vaccination, and even the commentators on facts who have been belittling this for a long time, some haven't, but many have, are arguing get vaccinated. Look, this is not about red states and blue states. It's literally about life and death. It's about life and death. That's what it's about. You know, and I know people talk about freedom, but I learned growing up in school and from my parents, with freedom comes responsibility. Your decision to be unvaccinated impacts someone else. Unvaccinated people spread the virus. They get sick and fill up our hospitals. And that means if someone else has a heart attack or breaks a hip, there may not be a hospital bed for them. If you're unvaccinated, you put your doctor and nurses at risk. The same frontline essential workers who put their lives on the line over the past year and have gone through hell. Again, with freedom comes responsibility. So please, exercise responsible judgment. Get vaccinated for yourself, for the people you love, for your country. I'm being literal when I say this. As I travel the world almost every day, a foreign leader calls me asking, can I provide his or her country more vaccines? Their people are desperate for vaccines. I'm doing everything to answer those calls. We're sending millions of vaccines to people around the world. But folks, it's an American blessing that we have vaccines for each and every American. We've made it our first and top priority to have available vaccines for every eligible American, and that's never going to change as long as I'm here. And it's a shame. It's just such a shame to squander that blessing. That's why after 6 months of extraordinary work and effort, today I'm laying out additional steps we should be taking to deliver these life-saving vaccines to more Americans. First, we're going to provide more incentives to encourage unvaccinated Americans to get vaccinated. That starts with paid leave to get the shot. We're still hearing that people are unable to get time off from their employer to get vaccinated. Well, this is unacceptable. For some time now, I've said you should be able to get the shot and still get paid. Thanks to the American Rescue Plan, the federal government is fully reimbursing any small or medium-sized business that provides workers with paid time off to get vaccinated. Employers, this costs you nothing. If you haven't given employees paid time off, do it now, please. Today, I'm announcing that we're taking this a step further. The federal government will now reimburse those employers to give their staffs time off, not only to get themselves vaccinated, but also to get their family members vaccinated. That means employers can get reimbursed if they give parents time off with paid time, paid leave, to take their kids or their own parents to get vaccinated. So I'm calling on all employees across the country to give paid time off to get the shot or to help a family member do so. I promise you, it will cost you, the employer, nothing. You'll be reimbursed. Secondly, I'm announcing that we'll continue to work with states to encourage unvaccinated people to get vaccinated. In February, the grocery store chain Kroger's offered $100 to their associates if they would get vaccinated, and it worked. Vaccination rates moved up from 50% to 75% among their employees. States like New Mexico, Ohio, and Colorado are offering similar incentive programs that have helped increase vaccination rates. So today, I'm calling on all states and local governments to use funding they have received, including from the American Rescue Plan, to give $100 to anyone who gets fully vaccinated. I know that paying people to get vaccinated might sound unfair to folks who've gotten vaccinated already. But here's the deal. If incentives help us beat this virus, I believe we should use them. We all benefit if we can get more people vaccinated. But in addition to providing incentives to encourage vaccination, it's time to impose requirements on key groups to make sure they're vaccinated. Excuse me. Just this week, we took an important step to protect our veterans. Like many civilian hospital systems are doing, the Department of Veterans Affairs will now require COVID-19 vaccines for doctors and nurses and other healthcare workers who provide medical care for our veterans. We must do everything possible to protect our veterans from getting COVID when they come to get medical care they so richly earned serving their country. We owe them. Next, since many vaccinations are required for active duty military today, I'm asking the Defense Department to look into how and when they will add COVID-19 to the list of vaccinations our armed forces must get. Our men and women in uniform who protect this country from grave threats should be protected as much as possible from getting COVID-19. I think this is particularly important because our troops serve in places throughout the world, many where vaccination rates are low and disease is prevalent. Next, every federal government employee will be asked to attest to their vaccination status. Anyone who does not attest or is not vaccinated will be required to mask no matter where they work, test 1 or 2 times a week to see if they've acquired COVID, socially distance, and generally will not be allowed to travel for work. Likewise, today, I'm directing my administration to take steps to apply similar standards to all federal contractors. If you want to do business with the federal government, get your workers vaccinated. Look at the Chamber of Commerce, representing tens of thousands of American businesses, the National Association of Manufacturers, the Business Roundtable, which comprises of the largest and biggest corporations in America. They're all applauding the actions the federal government is taking and urge them to follow suit. I also commend the National Football League. It has announced that if there are outbreaks among unvaccinated players and personnel, then the team risks forfeiting games. I urge other sport leagues at every level to take every step they can. Every day, more businesses are implementing their own vaccine mandates. And the Justice Department has made it clear that it is legal to require COVID-19 vaccines. We all want our lives to get back to normal. And fully vaccinated workplaces will make that happen more quickly and more successfully. We all know that in our gut. With incentives and mandates, we can make a huge difference and save a lot of lives. I also want to speak to families with children in school. We can and we must open schools this fall, full time. It's better for our children's mental and emotional well-being, and we can't afford another year out of the classroom. Every school should be open, and we're giving them the tools to be able to do so safely. Even in those areas where they have a higher vaccination, they have a higher rate of COVID. Through the American Rescue Plan, we provided schools billions of dollars to implement safety measures. better ventilation, social distancing, and other measures. In March, when vaccinations were scarce, I prioritized teachers and school workers by utilizing our federal pharmacy program. Almost 90% of educators and school staff are now vaccinated. Additionally, the CDC has provided clear guidance on how all schools can safely protect the kids and bring them back to the classroom. Every student wear a mask. It's that simple. So we've funded safety measures in schools, we've vaccinated teachers and staff, and we can mask up our kids for further protection. But once again, there's one more thing we need to do. Get more adolescents ages 12 and up vaccinated now that they've been cleared. In the past week, the good news is we've seen the average number of 12 to 17-year-olds getting vaccinated increase 22% per day. Today, I'm asking school districts to host one last pop-up vaccination clinic over the coming weeks for kids ages 12 and up. We're directing the federal pharmacy program to help make that happen. Parents, get your children vaccinated. You do it for so many other things right now. For kids under 12, if and when the vaccines are deemed safe for them, we'll be prepared to get the vaccines administered as quickly and as safely as possible. Look, and as we work to vaccinate more Americans, we're prepared for outbreaks in areas where there are unvaccinated people. My administration has made it clear to every governor that more federal resources are available to them. This includes deployment of surge teams composed of experts from the CDC and the Federal Emergency Management Agency, the FEMA. We're going to continue to provide states with more testing, treatments, protective equipment, personnel, mobile vaccination clinics to stem the surge of the virus among the unvaccinated. The pictures of hospitals in several states overloaded with patients is unnecessary, avoidable, and tragic. You know, we'll help any health system overloaded and unable to cope with the spike in cases. We're ready to do that. Let me close with this. If you're at home and vaccinated, but anxious, or even angry, or if you're at home and unvaccinated, unbothered, and unconvinced, let's step back and see where we are. Just remember how we've emerged from a dark winter into a hopeful spring and summer. But really remember just how dark that winter was. Over 3,600 Americans were dying each and every day. And now, even with the surge among the unvaccinated, we're down to that 300 Americans a day. Significant. Millions of people were out of work, out of homes, out of hope and going hungry. Remember those long lines? People in their automobiles waiting for a box of food to be put in their trunk? Experts and pundits said we couldn't get the vaccines. And even if we could get the vaccines, we couldn't get it in people's arms. We couldn't get them vaccinated. They predicted our economy would collapse. Remember how we stayed focused and how we went to work? In 6 months, we got 164 million Americans fully vaccinated. Because we vaccinated so many people, put in place so many safety measures, and got economic help to businesses and people most in need, our economy is recovering. More than 3 million Americans are back to work since I was sworn in. A faster job growth than any previous administration, any. We're experiencing the fastest economic growth in nearly 4 decades, the best in the world as of now. In fact, today's GDP numbers show that in the first half of the year, our economy grew faster than any point in nearly 40 years. Our economy grew more in 6 months than most Wall Street forecasters expected for the entire year before we implemented our plan. And just yesterday, we announced a bipartisan infrastructure deal that's going to continue this momentum over the long term by making the most significant investment to rebuild America in nearly a century. But we still have to face many challenges. We still have a lot of work to do as we readjust to a post-pandemic economy. But we have the right plan. We're coming back. We just have to stay ahead of this virus. I know this is hard to hear. I know it's frustrating. I know it's exhausting to think we're still in this fight. And I know we hope this would be a simple, straightforward line without problems or new challenges. But that isn't real life. We're coming out of the worst public health crisis in 100 years, the worst economic crisis since the Great Depression. As I told you before, I carry a card in my pocket. I hope I have it with me. I have a carry card in my pocket with the number of Americans dead from COVID-19. As of today, this morning, the total deaths in the United States were 609,441. Granted, the death rate per day is way down. It's down to 400 about day. But that's more deaths than World War I, World War II, Vietnam, 9/11, Iraq, and Afghanistan wars combined. This is as tough as it gets. And we're Americans. When we get knocked down, we get back up. That's who we are. That's what we do. That's why there's no nation on earth like us. And we're prepared like never before. We have the tools to save lives, to keep our economy growing and growing and going. After the past 6 months, following the science, we know we can dramatically lower the cases in this country. We can do this. We brought our economy back to life and we kept it going. We know we can send our kids back to school. We know we can beat this virus. We can do this. We all just have to do our part. My fellow Americans, this nation has never failed. We have come together as the United States of America. So I say to all those who are unvaccinated, please, please get vaccinated. And to the rest of America, this is no time to be despondent or let our guard down. We just need to finish the job with science, with facts, with the truth. And together as Americans, we're going to be able to beat this. May God bless you all, and may God protect our troops. Thank you.
Mr. President, Mr. President, why do vaccinated people still need to mask up? Mr. President.
How long do you think it might be necessary to wear a mask, and at what point do you think people might have to have a booster shot? Thank you.
I said in my talk, the booster shot is not needed now. It is possible that it will be needed later. I don't know. The science hasn't dictated that yet. And the first part of your question?
I think people might have to wear a mask again.
Well, if you notice, a lot of places people don't have to wear masks. Let's get that straight. The places where people have gotten vaccinated, where we have a high vaccination rate, people do not have to wear masks at all. Like some of you were with me yesterday when I was up in Lehigh Valley. Didn't have to wear masks there. Don't have to mask if you come home to Delaware with me. I know you love doing that. But you don't have to wear a mask. The places people are probably going to have to wear masks in those communities where the high rate of unvaccinated stays high and they don't move. They don't move to getting vaccinated. But I think you're going to find the patience of businesses and the patience of a lot of other people running thin. Because the fact is, if you had high vaccination rates, we wouldn't be in this spot right now. Yes, sir.
Mr. President, will this set up an American workplace for federal workers and private sector that really is the vaccinated versus the unvaccinated? And is that a pressure you're trying to harness now?
Well, no, I'm not. Look, what I'm trying to do is keep people safe. I mean that sincerely. So, if in fact you're unvaccinated, you present a problem to yourself, to your family, and to those with whom you work. Because as pointed out, I was asked a question about why would people who have already been vaccinated get it? Well, you got anywhere from 2 to 3% on average, the last study done, that can still get COVID. They don't get very sick. They don't get hospitalized. It's not serious, but they can catch it. And the concern is they may be able to pass it on. And so that's all being studied right now. But it's the important thing is, if people are vaccinated, the transmission rate drops through the floor. And that's all we're trying to do. Yes.
Mr. President, thank you. Why not push for vaccine mandates in states, private companies, schools? Do you want to see those entities pass vaccine mandates?
Well, I'd like to see them continue to move in that direction. And that's why I pointed out. I had asked the Justice Department to determine whether they're able to do that legally. And they can. Local communities can do that. Local businesses can do that. It's still a question whether the federal government can mandate the whole country. I don't know that yet.
Mr. President, you said earlier this week that we are not headed back towards lockdowns. But if the science is evolving, how can you be so confident in that? We heard you say weeks ago that the virus was on the run, but Dr. Fauci has also indicated that we are headed in the wrong direction.
Well, you know, you're literally correct on everything you said, but it doesn't come to the conclusion you're implying. It is clear that if everybody's vaccinated, the existing vaccines work to prevent death, serious illness, hospitalization. Okay? If tomorrow I could wave a wand and every American was vaccinated, then in fact we'd be out of the woods. Now, can something else happen a year from now? Can there be a different virus? Can there be something? It's possible. But I'm talking about COVID and the existing variants that have come forward so far. So it's a simple proposition. If you're vaccinated, you find yourself in a situation where you are highly unlikely, even if you somehow get the virus, very small percentage do, that you are not going to be hospitalized, you're not going to be on a ventilator, you're not going to be sick, but you could be in a position to possibly spread it to someone who wasn't if you have it in you. Yes.
Thank you so much, Mr. President. Thank you. I wanted to ask, why not require that the people show proof that they're vaccinated? And also, if you could just, with the 4 million, how much of an impact do you think this will have? Do you have a projection, sir?
A projection on what?
On how many people will get vaccinated by putting in this system?
No, I'm not going to get in the business of projecting. Exactly how many people are likely. All I know is that we go through these periods, then we run up against a wall, then something happens where people realize, oh my Lord, this is really a problem, and they begin to see things. Look, the fact that a lot of your friends are now saying, get vaccinated, who were before were saying, it's not a problem, this is all a Democratic thing, with a small d and a capital D. I mean, there's a lot changing. People are becoming aware. The more aware they become, then we have these surges of people going out and getting vaccinated. And it just keeps building.
I'm sorry, sir.
What about
What about requiring proof, sir?
Well, there's two ways to do it. I think you're going to see some institutions doing that. Like, you're going to fly abroad, you're going to have proof. You're not just going to be able to say, yeah, I got tested. You got to provide proof. My guess is if we don't start to make more progress, a lot of businesses and a lot of enterprises are going to require proof for you to be able to participate.
Mr. President, back.
And then I'm going to take off shortly here.
What further actions are you going to take to encourage private businesses to follow this type of model to either require vaccines or require testing or other preventative procedures?
I just did. I'm going to keep at it. I'm going to be talking about it around the country.
Are you ready to go To reach out to private businesses, meet with them, try and actively encourage them to follow this model?
Well, I have. That's why we have folks from from the Chamber of Commerce to the manufacturers, et cetera. So, am I going to call a meeting of every, business in the country to come to Washington or go on? I have made the case repeatedly. I doubt whether there's a single solitary business that doesn't understand that I think it's smart for them to require testing, and if you can't demonstrate, you can't prove you've been vaccinated, you have to be tested.
Secretary Austin said he was already considering mandating the vaccine after it was fully approved. Would you like to see the mandate go into effect before full approval, and do you think he's open to that?
I know he's open to it, and the question is, when is the right time to get the most bang for the buck when you do it? A lot of this is timing, and so I think it's going to happen. But look, the one thing that you all are being politely and appropriately referencing is that it's still a temporary approval. So when does the final approval come? It usually takes a lot of work to get there. I made a commitment. I would not tell anyone in the Justice Department who they should prosecute, and I would not tell the health industry, the government health entities, what they should say and do. But my expectation is they're going to reach that conclusion in the early fall. Thank you very much.
And the President of the United States pleading with the American people who are still unvaccinated to get a shot, not mandating, but instead offering measures to incentivize. Let's listen.
In May, you made it sound like a vaccine was the ticket to losing the mask forever. And
That is true at the time, because I thought there were people who were going to understand that getting vaccinated made a gigantic difference. And what happened was, the new variant came along, they didn't get vaccinated, it was spread more rapidly, and more people were getting sick. That's the difference.
but how frustrated are you with those people, sir?
And testy president offering a final response to a question from a Fox News Channel correspondent asking the president about why he said just less than a month ago that there would be independence from the virus. The president making the case that the virus has changed. This new Delta virus and variant is especially contagious and infectious and dangerous. Let's get more on this from Chief White House correspondent Nancy Cordes at the White House. And Nancy, really the president doing just about everything he can short of mandating it to try and incentivize people to get the vaccine.
Right. He's basically telling federal workers who don't get vaccinated, you're going to have to run the gauntlet when you come to work. You will have to get tested once or twice a week. You will have to wear a mask. You'll have to be physically separated from your other coworkers and anyone else who visits your agency, and on and on. So he's trying to make it as onerous as possible for those who don't show proof that they have gotten vaccinated, Nora.
And Major, the president saying state and local governments should pay people $100 to get a vaccine, but there are still a number of groups that are pushing back on this, not just Republicans, but unions.
That's right. And there is this sense that you do have the freedom to say, I don't want to get vaccinated, I'm skeptical, I'm still unsure. But the president is trying to put together, as Nancy indicated, incentives and disincentives. If you don't want to run this gauntlet, get vaccinated. And what he's hoping is that the pressure applied by the federal government through federal employees and federal contractors will radiate through the private sector, and businesses will carry out the very same message. So it'll be harder and harder to look across America and say, oh, I'm unvaccinated and nothing changes in my life. No, things will change for your life at work and elsewhere, and possibly also for your children. A range of incentives, but also now, for the first time from the Biden administration, disincentives. Your life will be demonstrably more difficult if you remain in the unvaccinated category.
The president also addressing a lot of the misinformation that exists and the fears that exist, pointing out that this vaccine was developed and approved under a Republican administration, and it is being administered under a Democratic administration. And in his words, this is not about red states or blue states. This is about life and death.
For the first time, name-checking Senate Republican leader Mitch McConnell and Kay Ivey, the Republican governor of Alabama, putting bring Republicans into his persuasive conversation in a way he simply hasn't done before.
Also want to bring in CBS News chief medical correspondent Dr. John LaPook. And Dr. LaPook, you know the science so well and speak to all of the officials. I keep thinking about, too, those 100 million Americans who are unvaccinated, that they are putting other people's lives at risk. Explain the science, because as one public health official told me today, those unvaccinated Americans, they can become vessels for that virus to create more dangerous variants, and will take us longer to get out of this pandemic.
Well, that's exactly right. I mean, somebody who's unvaccinated, you've heard them saying, well, I'm rolling the dice for myself. I get infected, I get infected. No, you're rolling the dice for yourself and for all the rest of us. And the reason is that when you get infected, you become a human petri dish. And billions of times this virus is replicating. And each time it replicates, it has a tiny chance, maybe 1 in a billion, of turning into one of these more vicious variants. Well, billions of replications, 1 in a billion chance, it can happen. When it happens, somebody can spread that, even if they have absolutely no symptoms, to the rest of us, to people who are unvaccinated, to people who are vulnerable, and especially to people who are under the age of 12. And, you know, when you look at this new CDC advice, which is based on changing data, that is exactly what the CDC should be doing. When the data changes, you change the advice. You don't double down on it and say, well, I'm embarrassed by the fact that the data changed. Nope, you give new advice based on the new data. It's exactly what public health agencies should be doing.
Right, not necessarily a backtracking or a changing. As the science evolves, so does the public health guidance, in your words, so we can defeat this virus. Always, Dr. LaPook, so good to have you. Thanks to Nancy Cordes and to Major Garrett. Our coverage continues on our 24-hour streaming service, CBSN. You can watch it at cbsnews.com or download the CBS News app on your cell phone or connected TV. There's going to be more in your local news, and tonight we'll have a full wrap-up on the CBS Evening News. This has been a CBS News special report. I'm Norah O'Donnell in Washington.
For news 24 hours a day, go to cbsnews.com.
Hi, everyone. I'm Elaine Quijano. Thanks for joining us. For more on the president's vaccine efforts, I want to bring in Dr. Leo Nisola. He's an immunotherapy scientist and an advisor to the nonprofit COVID Act Now. Doctor, welcome. Thanks very much for being with us. So as we've been listening to for the past hour or so, the Biden administration is now using its power to require vaccinations or testing and other mitigation measures among federal workers and potentially the military, as well as pushing state and local governments to incentivize inoculations. Doctor, what is your reaction to these moves? Are they enough?
Yeah, thanks for having me. First, let's just acknowledge that this is a very difficult moment. I particularly did not anticipate that we were going to face so much hesitancy around a life-saving vaccine in the middle of a pandemic with a deadly variant out there. So I think President Biden touched a very important point, which is maintaining public safety. And honestly, today, how would you go about your life without the assurance that people around you in public spaces are fully vaccinated? We still don't have vaccine passports or a way of ensuring that people that are around you in a bus, in an airplane, in a hotel lobby, or even in your local grocery store, if they are carrying the virus, if they are vaccinated, or if they are anti-vaxxers and fully unvaccinated. I also think that we can't wait any longer. So I liked to see President Biden taking this approach of a head-on, addressing the issues, being clear on the messaging. I think the CDC has had a little bit of a challenge with the messaging around vaccine and what the vaccinated individuals can do and what the unvaccinated individuals should do. And I think the message today was pretty clear. It couldn't get anything clearer than that. That said, I think mandates are very complicated.
Mm-hmm. Go ahead, Doctor.
I think mandates are very complicated, especially for someone that works in the healthcare space like I do. But still, when we have a deadly virus with a variant that has already taken that many lives and has taken our civil liberties, it's very complicated to wait a little bit longer for folks to get on board. Now, the science is clear. There is no scientific reason not to get vaccinated. So I would expect that as soon as the FDA approval comes, mandates should come. Moreover, we should also talk about what President Biden mentioned about the private sector, which I agree. I think we should pressure the private sector to be enforcing vaccination proof and enforcing mask mandates in their venues, as long as there is the danger of the unvaccinated out there.
So, Doctor, you mentioned having that full FDA approval of those Pfizer and Moderna vaccines. At this point, what additional actions do you think would encourage more people to get vaccinated?
I think the full confidence of the agency on the efficacy and the safety of both Moderna and Pfizer's vaccine, it's a great first step. I think before we think about mandating vaccines for everyone, we should be able to approve them. Moreover, I think also it's important for us to hold accountable those who are spreading misinformation online. I think before COVID, in a pre-COVID world, we had to address vaccine hesitancy and treatment hesitancy in a one-on-one approach by showing data, by showing science, and speaking to people in the way that they understand. Now, with the online campaigns against a vaccine, anti-science, it's very hard for this to be done in a one-on-one level. So I would expect that these online platforms that are spreading these messages on behalf of those users could get a fine or some sort of accountability, because these posts are live. If you do a quick Facebook search, you would find a lot of vaccine misinformation still today.
Right, it's an ongoing problem we've continued to see manifest itself throughout the pandemic. Dr. Leo Nisola, doctor, thank you very much.
Thanks for having me.
We'll have more on this in a minute on Red and Blue. Stay with us. You're streaming CBSN, CBS News, always on.
Good evening from our CBS newsroom in New York.
From the very beginning, CBS News has looked for new ways to reach people.
Today, that mission to tell the story of all our lives is stronger than ever.
It's important that we remember the story correctly.
A smart start to the day with facts first.
Unbiased reporting, making sense of our world every evening.
Who's responsible?
We found one hell of a story of survival.
CBS News. This is why.
Did you know CBSN has 11 local streams from coast to coast? You can watch wherever you are. Just download the free CBS News app or check us out on all your favorite platforms. We're always on.
Hi, everyone. I'm Elaine Quijano. It's good to be with you. Thanks for joining us. The White House is ramping up efforts to close the gap in vaccination rates as COVID-19 cases continue to rise. Here's how President Biden addressed the nation Thursday.
And I hope all Americans who live in areas with substantial or high case rates will follow the mask guidance that's being laid down by the CDC. I certainly will, and I have, because this is one of those areas in Washington. And at my decision, my direction, all federal personnel and visitors to federal buildings will have to do the same thing. As I said from the beginning, a mask is not a political statement. It's about protecting yourself and protecting others. Masking is one defense against the spread of COVID-19. But make no mistake, vaccines are the best defense against you getting severely ill from COVID-19.
The president is calling for $100 payments to be given to every newly vaccinated American. At the White House, unvaccinated federal workers will face strict new testing and social distancing requirements. As of Wednesday, the U.S. was just shy of reaching 70% of adults at least partially vaccinated. The president had wanted to reach that number earlier this month. Earlier Thursday, the Commerce Department said the U.S. economy grew 6.5% in the second quarter. That's a full return to pre-pandemic gross domestic product levels. However, that's below the 8% growth economists had predicted. The White House says vaccinations are key to the economic recovery. Meantime, tensions between members of Congress are rising after U.S. Capitol Police were ordered to enforce a new mask mandate in the House. We'll have more on that in a moment. CBS News Chief Washington correspondent Major Garrett, though, joins me now with more. Hi there, Major. So, for months we had seen this White House try to appeal to those who are unvaccinated through PSAs, through public health briefings. We're seeing a different approach now. What are some of the creative ways the White House is trying to incentivize people to get vaccinated?
Well, it's an important point, Elaine, and for 6 months, this administration was devoted entirely to the availability of the vaccine, the distribution of that vaccine, and persuasive rhetoric to Americans to get in line and get their jabs or get in their car and drive to a place where they could get their shot. Those days are now taking a backseat to a new combination of incentives, but for the first time, and this is really important, Elaine, disincentives. The disincentives are as follows. If you're a federal employee or a federal contractor, and that's millions of people who work in this country, you're going to have to be tested regularly if you're not vaccinated. You're going to have to wear a mask inside work. You're going to have to be socially distanced from your coworkers, and you're going to travel less. And the White House believes that that edict for federal employees and contractors will radiate through the private sector, demonstrably changing the lives of people who work who are not vaccinated, sending them a very strong signal. That's not an incentive, Elaine. These are now disincentives. Your life will get worse, harder, more onerous in terms of protocols that you're going to have to live up to continue to carry out your job. This is a new tactic by the administration because it has learned the hard way that persuasion, availability, and distribution simply were not enough. And Elaine, it's worth underscoring. The White House did not expect or want to be in the place it finds itself now. 25 days ago, on July 4th, President Biden said, this virus no longer controls our lives. It no longer paralyzes us as a nation. We're not talking about paralysis or control, but we are talking about reimposing things that the White House believed it had put behind us and the nation had put behind us, specifically the entire trench warfare argument about masks. They're now back in vogue because of the CDC recommendations. It's worth noting in May, the CDC said, hey, no masks for the vaccinated. But that wasn't how the country heard it. The country heard it as no masks at all. And that complicated everything in the ensuing couple of months, placing the White House unexpectedly, unhappily. And the president said himself at the end of the remarks, I know it's frustrating. I know it feels exhausting. I guarantee you there are those in the White House who feel frustrated and exhausted as well.
Yeah, and so I want to dig into that a bit more when it comes to the political backlash, Major, because we've been seeing this play out now for weeks. Questions about masking for unvaccinated people. Why is it that that is necessary? And the science is still very much evolving with respect to those breakthrough cases, for instance, in our understanding of how contagious a vaccinated person who gets COVID might be. There are all kinds of unanswered questions. And it's a nuanced discussion. The messaging, as you point out, has been difficult or problematic, I think it's fair to say, for these public health agencies. Tell us about that political backlash that, as a consequence, the White House has been facing. Right.
Politics is a reflection of how people feel those in government are either helping them or hindering them. That's a general statement. That's a meta observation about how politics works. People feel the government is either helping them or making their lives miserable. Well, in this case, we have a mixture of both. People say, hey, I have a vaccine. It's available. It's free. It's accessible. I've got it. I'm happy. People feel there's a mask mandate. I don't want to wear a mask. I feel it's an imposition on me. Or the vaccine I'm still not sold on, and yet you're constantly hectoring me to get a vaccine. It comes at them in both ways. So a couple of things about that, and I'll do a very brief commercial for the takeout tomorrow on CBSN because I sit down for nearly an hour with Lena Wen, who is a former health commissioner in Baltimore and a very well-respected public health professor at the George Washington University. And she said, look, I am unhappy with the CDC and I'm unhappy with the Biden administration's mixed messaging on this. She said in May we should not have told the country, take your masks off. We should have said testing is going to be ramped up, vaccinations are going to be prioritized, and we're going to put in place these disincentives, she would argue, on behalf of mandates sooner. Why? Because in her opinion, and she has data to back this up in the city of Baltimore, mandates change behavior. They take all the fence sitters and put them in the vaccinated category. And she says America simply has too many fence sitters when it comes to vaccinations. And she said, if you want to avoid the dog-eat-dog, intense politics over masks, prioritize vaccinations. And I think it was very important on this political question, Elaine, that for the first time, President Biden credited a Republican administration. He didn't say the Trump administration, but at least he said a Republican administration for creating the vaccine. And then he name-checked Senate Republican leader Mitch McConnell as being an advocate all along for vaccines. And he name-checked Kay Ivey, the Republican governor of Alabama, talking about the necessity to get vaccinated. Bringing Republicans into the conversation from the bully pulpit of a Democrat Biden-led White House is a new approach. It's probably not too late, but it's later than it should have been. I've always been astonished that this administration has been unwilling to say, look, Trump supporters, your president created this vaccine. He deserves tremendous credit for that. We're not going to talk about anything else he did, but that thing he did right. And because he did that right, that should increase your level of confidence. Until now, they've been reluctant to do that, but the president at least laid down that rhetorical marker today.
All right, I'm really looking forward to the next episode of The Takeout. Major Garrett for us. Major, thank you.
You got it.
For more, let's bring in Sarah Muha and Mike DeBonis. Sarah is a political reporter for Axios, and Mike is a congressional reporter for The Washington Post. So, Mike, as we mentioned, tensions on Capitol Hill have reached a boiling point following new mask mandates. I want to play a video that Republican Congresswoman Nancy Mace of South Carolina posted on Twitter earlier.
In the tunnels this morning, socially distant from anybody else. I had COVID. I've had 2 vaccinations. I'm washing my hands. I'm even wearing my mask inside the chamber, but I'm not going to wear it anywhere else. So, Madam Speaker, come and get me.
So how are both sides framing the partisan battle over public health?
Thanks, Elaine. Well, I think it's a lot like we've seen in all these other different settings. It's